Hey you guys, my name is Victoria Locklear and I'm a UNCP nursing student. This is my self-reflection video in smoking in the elderly population. So let's get into it. What did you learn in health assessment that contributed to your service learning project? There are many things that allow me to contribute to what I learned from health assessment, but most importantly, my biggest asset was the risk factors and abnormals that are related to a smoker. The risk factors that linked with my research were cardiovascular disease, high blood pressure, stroke, aneurysm, dementia, osteoporosis, eye diseases, diabetes, respiratory diseases, and cancer. It was great to see the material all come together in a real life scenario of an elderly patient. We went over all of these in health assessment. It was also interesting to see the abnormals I learned about in health assessment align with the patient who smokes. These abnormals consisted of dry skin and wrinkles, the thick dark mucus in the lungs, and an overall weakening of the immune system due to the high potency of chemicals, which makes it more difficult for your body to heal when severe and potentially fatal diseases and illnesses onset in an elderly patient. It was also interesting to see how smoking increases your heart rate, tightens the major arteries, and can cause an irregular heart rhythm, of all which make your heart work harder. And we went over this in health assessment as well, and it was in our book as well. Cardiovascular, when a patient smokes, you can get cardiovascular disease, and it does all of these things to your heart. And also for lung damage, smoking damages your lungs and airways, sometimes causing chronic COPD and emphysema, which destroys your lungs in the long run. In patients with lung diseases, as I learned in health assessment, you will hear lung sounds such as crackling, which is rills. This is a series of short explosive sounds. They also sound like bubbling, rattling, or clicking. Rhonchi, these low-pitched wheezing sounds sound like snoring and usually happen when you breathe out. They can be a sign that your bronchial tubes are thickening because of mucus, which is also seen in smokers. And also wheezing. This high-pitched whistling noise can happen when you're breathing in or out. It's usually a sign that something is making your airways narrow or keeping air from flowing through them. And as I addressed before, we went over all these in health assessment. So it was really, neat seeing it all come together. In what way did your service learning project contribute positively to the community? My service learning project contributed positively to the community by allowing me to inform the elderly on how smoking affects their specific age of population. This made me feel like I was making a difference while presenting this presentation. I was able to talk and inform the community the risks of smoking in the elderly, which was many chronic diseases, and I hope this will open up their eyes to realizing just how much of a toll smoking takes on the human body, the elderly in particular. I was able to discuss how smoking affects the human body and gave information to the elderly about therapies and treatments to help them quit smoking. I was also able to provide smoking cessation education to the elderly, which in turn I hope will increase quitting rates, which will decrease diseases and mortality. Most importantly, the biggest takeaway I hope the elderly remember is to make the elderly realize that it is never too late to quit smoking. Some elderly may think, well, I'm going to die from this anyway, so why quit now since I've smoked for so long? However, I hope this video makes them realize that your body instantly starts to heal as soon as you stop smoking. Furthermore, within years of quitting smoking, your risk of dying from any smoke-related disease will decrease to that of a non-smoker. Overall, I contributed positively to my community by giving hope in elderly patients that smoke, informing them that they are very likely to add years to their life, breathe more easily, have more energy, and save money if they quit smoking. Thank you for your time, you guys.